Next, I invite Dr. Prasanna Venkatesh Ramesh to present an innovative, self-built, cost-effective and patent-protected 4D holographic ophthalmic metaverse. The judge for this is Dr. Preetham Samant, sir.
Thank you for the opportunity. So mine is a metaverse that has been done cost effectively. So this is a patent protected technology that I would like to share. So last year we were able to crack in the fourth dimension. So we invented the holograms at our center, and we were able to make sure that the examinations were done in fourth dimension. As you can see, my friend on the right is examining the patient with the holograms and the headset. So this is a NTG glaucoma, as well as you can see another patient which has RNFL defect. So we were able to crack the holograms on a fourth dimension level with the VR or the AR headset or the mixed reality headset that we would like to call. But there were many limitations with the headset because it was not really kicking off as the way we wanted to. So in a country like India, nothing reaches like in a smartphone. So we had to reinvent ourselves with the LiDAR technology. So we had to make sure that to reach the masses, we had to go to the smartphone. And this is the QR code that we have innovated, and it's more like an EMR as well as for teaching. So I call it the subtractive ophthalmic learning. You can see the buttons on the bottom here. So once the patient's data is scanned, you can see that the template has been created. So once you click the button, the different subtraction happens. So if you want to remove a particular structure, if you're having a neuro-ophthalmic practice or for the ophthalmology as well, you can use different filters like ASOCT, ultrasound, or you want to use any ophthalmic. It's a translational software basically. So we have given the buttons below, and it can be done by tactile dissection. All you need to do is use your phone with your fingers. You can do tactile dissection, or you can use an augmented reality module, as you can see on the right. On the left hand side, you can use your fingers as buttons, or on the right hand side, you can see, you can click the smartphone, you can use your LiDAR technology, and you can see that the template is there on your table. Like wherever you are, you can just need to focus on any particular thing. You just need to open your camera. And also we have worked on a 3D smartphone simulator. You just need to move your phone like a fundus ophthalmoscope. It can be used as a simulator. There are a lot of advantages with this, with dexterity and other things. We see the scope in pedagogy, in simulators, as well as having your own ophthalmic case sheets of the patients as EMR as well. So we have currently worked on that as well, which I'll be showing. So this is the right hand side. You can see that once a patient has been examined for a fundus or a OCT or for any examination, even an gonioscopic picture per se, automatically it gets filled into this template. So that is the software that we have innovated. So this is how we created the template. The template creating was the more tougher part because we had to make sure that the template had to be created slightly differently compared to the one that we had for the headset, which we had to now reinvent back for the smartphone, because smartphone we felt reached more masses than the headset, because headset was not really kicking in. Geo never launched its Geo headsets. So now you can see these are the amalgamation of patients' data that we start collecting in our OPD. You can use different filters in the fundus. You can use a red-free filter. You can use a different kind of filters, and you can also use these for counseling, my dear friends. Even for AIOC PI counseling, it is all available in 3D. At the end of the day, if the patient downloads a particular app, individually the patient can be customized for his particular app. So we don't need to attach a printer or something. A three-dimensional case sheet. You can see this is the workflow that we have currently cracked. A patient walks in, you do certain examinations like a fundus or OCT. It goes into our database. It's a translational software. Under 60 seconds, a hologram is created. It's currently under alpha testing, but we should be able to crack this on an EMR level as well, where there will be a three-dimensional or a four-dimensional EMR, where you can also see just in your smartphone, you can focus on this. You can extrapolate the OCT also out of it, because we have coded on that level that even it can be superimposed even on anterior segment images as well. I personally believe, and this is published recently in 2023 in the European Journal of Ophthalmology, and this we call fondly the ophthalmic metaverse, and we have made sure we never leave any blind spot in the patient's case sheet or for counseling or for simulation. So this is my team, and thank you once again for this opportunity.
Yeah, it's a really wonderful, innovative technology. Uh, First, my question is like to know about your background. How come you are so well versed with these raw technological things?
Sir, I
It's
scored.
really very difficult for a doctor to do such kind of things. Yeah.
Sir, I scored 199.75 was my engineering cutoff, sir. But my dad put me into Honest answer, sir. He's
So,
here.
yeah.
Sir, he
So,
did not even allow me to put counseling for Anna University, sir. Otherwise, I would have escaped.
so previously you was a wrong man for a wrong for a profession, but now you have become or converted yourself to a
Yes, sir.
right man for the profession. So
Yes,
where
sir.
there was lacuna, you are introduced in.
So, but
So
I
it,
always had this passion for the Iron Man as well as Blade Runner 2049. But now I'm loving my specialty. I'm a glaucoma person. I love my specialty. I'm trying to marry ophthalmology with technology, sir. No, I. Ma'am, no, ma'am.
it, it seems to be path breaking. Actually, I don't think any such thing or any of the parallels are there in the technology right now. So
Yes, sir. Currently in literature, metaverse, we were able to crack it in the fourth dimension, sir. That is with the headset. But that never really picked off, sir. But with this app, many downloads have increased. And even when I had a discussion with Arulmali Varman, sir, he was the one who gave this idea on EMR. So currently we are working on EMR as well with this technology, sir.
have you launched it commercially also,
Sir,
or
it is available.
is
It is
it
available
available?
today, sir. The QR code, or you can type IMG Max, EYE space MG space Max. If you have an Apple or an Android phone, you can type that today in the App Store. It's for 3 days. We have given it free of cost, sir. It's on trial, and after that it will be chargeable. Now it is available for teaching and counseling. But since the EMR is in the alpha testing stage, for this software to really work, we have to do some more efforts so that it can work in everybody's hands for an EMR level. Yeah. Yes, sir.
So you
Dr.
have
Venkatesh,
opened up a sea of opportunity. Actually, it's really,
Yes.
really wonderful in my opinion.
will it be helpful for the DR screening?
Sir, screening per se, it
Yeah.
will be helpful, sir. But this is not a imaging tool. This is a translational tool.
Okay.
So for a DR screening, again, it is not going to replace an imaging modality.
Right.
But if you have a good imaging system somewhere where you have funders, OCT, and you have so many imaging modalities, they can send you. Personally, I feel when the patient takes a case sheet and gives in a two-dimensional plane, sometimes it may not be maintained well. But if I'm referring somebody, there is a three-dimensional case sheet. I feel that we are doing good for the doctor who the patient is going to see next, because he can see exactly the way the things are, is what I envision, sir.
Okay. Thank you.
Thank you, ma'am. Thank you, sir.